Thank you very much for having me give this talk. It's my pleasure to be here and to talk to you all. I'm going to put some slides up, and my talk will use these slides. Hang on one moment. Let me go to the slides. All right. All right, so this is the title of the talk, Global Catastrophes Before, During, and After COVID. And let me begin, I'm having a problem here, okay, with some background. And here's the background. You know, I wrote an article for the Institute last year, and in the article I said that we face numerous global catastrophic risks. And that's been much of my work in the last several years, is catastrophic risk. But one of them is a major pandemic as bad or even worse than the 1918-1919 Spanish flu. And I don't want to say I told you so, but here we are with COVID. So should we be surprised about this? You know, should this come as a big shock? Well, 3 years ago, the CDC, that's the Centers for Disease Control in the US, wrote, and I'm going to quote here, "The threat of a megavirus that could cause widespread fatalities is considerable. While we can't predict exactly when or where the next pandemic will begin, we know one is coming. The reasons? Increased risk of infectious pathogens spilling over from animals to humans, which is what happened with COVID, development of antimicrobial resistance, spread of infectious diseases through global travel and trade. Again, with COVID, we see this. Acts of bioterrorism, and weak public health infrastructures." So this is what the CDC wrote 3 years ago. And I used this quote in a paper I wrote recently, looking at pandemics, actually, and what should be done to try to reduce the threat of pandemics. So we've known for a long time that this is possible, that this is coming. And, you know, we didn't know when or what it would look like, but we knew that there's a serious possibility of a pandemic. And sure enough, here we are with COVID. So what have we learned from this? And what should we do? And that's what I want to talk about. First of all, you know, I've been writing for several years now that we face numerous potential global catastrophes, new pandemics, and we still face them. Nuclear terrorism, bioterrorism, a climate catastrophe, a global financial collapse, a major earthquake, not a small one, major earthquake. You know, there's a whole bunch of things that we have to worry about. And we prefer not to. Most people don't like to think about these things. In fact, my wife always tells me that I'm a pessimist. You know, I'm not fun to be with because I talk about this stuff. But I think we need to think about this. We need to talk about it. Unfortunately, we are unprepared for this. And my view is we have to get prepared, not wait for these things to happen, but to get prepared. And it raises the following question. What fraction of GDP, what fraction of economic output should be devoted to reducing our vulnerability to these risks? Because it's expensive. How much should we spend? And the answer depends in part on how we value the loss of human life, because some of these catastrophes, pandemics are an obvious example, kill people. And so we need to think about, well, how bad is that if we lose, if hundreds of thousands of people die, how bad is that? And that's another thing that people don't want to think about. We don't like to think about that. It's not a fun thing to think about. So we ignore it, we avoid it. All right. Let me say a little bit about how we look at policies, these kinds of policies to avert the potential risk of catastrophes. The standard framework we economists use is cost-benefit analysis. So we have to ask, what's the benefit of either averting, preventing a potential catastrophe or reducing its likelihood? And we usually look at that in terms of something that we call the willingness to pay, WTP. This is society's reservation price. The most society would give up in order to prevent this kind of catastrophe. You know, it might be based on the sum of averted future losses of GDP, somehow discounted. Usually what we do is we express this willingness to pay as an annual percentage of GDP that society is willing to sacrifice. Now, let me clarify something. What is a reservation price? And this is an economic concept. So in the morning, I need coffee. And my reservation price for the first cup of coffee in the morning is very high, $20, all right? I don't have to spend $20. Now I'm home, so I just make the coffee. But even if I'm at work, I can buy a cup of coffee for $2 or $3. But my reservation price, the willingness, the most I pay, is much higher. And that's what we're looking at here. What's the most we would pay? Doesn't mean we need to pay that much, but what's the most we pay? And that's the idea of the benefit of reducing the likelihood or averting a catastrophe. Now, what about the cost? That's the benefit. What about the cost? Well, we can look at that in the same way. What is the annual percentage tax on consumption or GDP that we would have to pay in order to avoid this catastrophe? Now, if the tax is less than the willingness to pay, then this is a good deal. That says the benefit is greater than the cost. We should do it, all right? If the tax is higher than the willingness to pay, then wow, well, we're not going to prevent the catastrophe. But this is the standard way of modeling this, of thinking about this for economists. Now, this is not easy. This is not a simple thing to do, because how do you figure out the cost of preventing nuclear terrorism? That's very tricky. And what is the willingness to pay? How do you figure that out? Very, very difficult. But this is how we would do it. And now here's something that makes it even more complicated. These are not marginal, small projects. Preventing pandemics, preventing nuclear terrorism, preventing a climate catastrophe, these are not little things. This is not like building a bridge or building a highway. The underlying assumption of standard benefit cost analysis is that the project is marginal. It doesn't affect the overall economy, but that's not the case here. Here, a project to prevent nuclear terrorism, climate change, whatever, is going to reduce GDP. It's going to raise the marginal utility of consumption. And the result of this is that we may not want to avert a catastrophe even if the benefit is greater than the cost. Which one should we avert? Suppose that society faces 7, let's say, big potential catastrophes. And suppose it's feasible to avert all 7. Should we? And the answer is not necessarily. Which one should we avert? Well, this is the problem that I looked at, now it's close to 5 years ago, with a co-author, Ian Martin, who's at the London School of Economics. And we wrote a paper called Averting Catastrophes, The Strange Economics of Scylla and Charybdis. We like to read Homer, the Odyssey. It's a wonderful story. These were 2 big catastrophes that Odysseus had to avoid, Scylla and Charybdis. And we wrote this paper showing how you would decide which ones to avert. I'm just going to show you some of the things that came out of it. This is a picture from the paper. This came out of the paper. And I'm going to explain. This is a little bit conceptual here. This parameter, eta, is what we call the social index of risk aversion. It's how risk averse is society as a whole. 1 second. So we don't know how risk averse society as a whole, but macroeconomic and financial data suggest that this coefficient is somewhere in the range of 2 to 4 or 5. So we picked two values, 2 and 4. The vertical axis is the willingness to pay. So here is a nuclear catastrophe. I don't know if you can see this on the left. A nuclear catastrophe is a blue dot. And the dot means that we should avert it. The horizontal axis is the required tax. The blue line is a 45-degree line. So if something's on the line, it means the benefit just equals the cost. Anything above the line, the benefit is above the cost. A dot means you should avert it. A little plus sign means don't. So on the left side, with the coefficient of risk aversion equal to 2, it says that for the 7 catastrophes, a pandemic, a virus, megavirus, nuclear terrorism, climate, that means bioterrorism, floods, major storms, and earthquakes, we should give up on the earthquakes and climate. You may not like that, but that's what this particular analysis shows. The right side, risk aversion is higher. Now we should prevent the climate catastrophe, but not worry about earthquakes, not worry about storms, and not worry about bioterrorism, all right? But we should worry about climate, nuclear terrorism, floods, and a virus. Now, there are a bunch of reasons why we get these results that I won't go into, but I want to show you one thing. This was 5 years ago when we did this. The particular catastrophe that has the highest benefit cost ratio, the benefit is way up relative to the cost, is the megavirus, the pandemic. You certainly should prevent pandemics, absolutely. You may not want to deal with climate change. You may not want to deal with bioterrorism, which is separate from a pandemic. I'm talking about a pandemic that's not caused by people, not engineered to happen, but that just happens, which is what COVID is. No question that that's something that should be averted, all right? So this is what came out of the earlier work. Now, during COVID, here we are now in COVID. What are we going to do? So in the short run is the next 12 months. There's not going to be a vaccine in the next 12 months. Whatever Donald Trump says, there's not going to be a vaccine in the next 12 months. And let me just quickly explain why. First of all, to do clinical trials in the United States, they've started clinical trials on 2 different vaccines. You need 30,000 people in each arm of the trial, the placebo and those that get the vaccine. And it takes a long time to get the results because you can't go and give people the disease. You can't go and inject COVID. You have to wait until some people get it, some don't. So it's going to take several months before we get any results from that. And that's just 2 particular vaccines. We're looking at about 8 or 9. The earliest we would have the results of those clinical trials would be somewhere around December, January. And then we have to figure out, okay, it seems to work, but how well does it work? How much immunity does it give? How do we manufacture it and then gear up production and produce enough that we can vaccinate hundreds of millions of people? That's not going to happen quickly. So you should think that in the next 12 months, between now and next summer, there's no vaccine, not going to be a vaccine. sadly, but that's how it is. What do we do? Well, what we do is social distancing, lockdown, school closures, no restaurants, no movie theaters, no bars, no baseball games, and so on and so on. But how strict? And for how long? In the United States right now, Boston, where I am, it's kind of loosening up. The restaurants are not open, but I can go swimming at the health club, and I can play tennis. And I don't have to stay home. I can go to the supermarket if I wear a mask. In some places, you can't do that. You have to stay home. So how strict and for how long do we do this? Well, once again, it's a cost-benefit problem. What is the cost of lockdowns and social distancing? The cost is mostly the economy, unemployment, lost GDP, but also education. If schools are closed, kids are not getting educated. So let me call that lost GDP. Let's take education and call it a loss of human capital, monetize it, and make it part of lost GDP. That's the cost. Again, that's not easy to figure out, but that's roughly what we're talking about. What's the benefit? Lives saved. Now, there's also health expenditures. You know, people don't go to the hospital. They don't have to be put in intensive care. They don't get put in a ventilator. But the biggest thing is lives saved. We don't like it when people die. But now we have a problem. How do you put a value on lives saved? How do you decide how much those lives are worth? Because if you don't put a monetary value, how do you do cost-benefit analysis? How do you compare it to the cost? So we try to put a value. And how do we do it? Typically, we use estimates of what's called the value of a statistical life, VSL. And we do this to value each life. And in the United States, and I'll explain later where we get this number, the VSL is about $10 million per person. So in the United States, when I say we, I mean the government, regulatory agencies, use a value of a human life of about 10 million. And I'll explain how later in a moment. And if you use that number, you're going to find that the benefit of strict lockdowns is much greater than the cost for most countries, much greater. And the reason is you're saving lives, and lives are very, very valuable. But is $10 million the right number? And I got to come back to this and show you that maybe it's not. And then the question is, what is the right number? Here's another problem with this cost-benefit analysis. Let's suppose you want very strict social distancing, lockdowns. You want to get the number R0, R sub 0, the contagion rate way down. You don't want people interacting. You say, we have to immediately lock everybody up. Nobody goes out. Everybody has to wear not just a mask, but cover their whole head, whatever. You're not allowed to breathe outside. All right, so you want strict lockdown. Now, what will that do? It'll save lives, no question. But it will also lengthen the duration of the pandemic. Let me show you something. And I wrote a paper on this that is referred to here, a recent paper. So this is what's called a simple SIR, susceptible, infected, recovered model with one extra variable called dead, the people who die. And it uses a 2% death rate, which may be too high. You know, you think 1% is the right number, just divide these death rates by 2. And what it shows is the dynamics of the infection in days for different degrees of contagion. R0 is a measure of contagion. In a strict lockdown, we'd want to get R0 close to 1 or even lower. If R0 is 1, then the epidemic, the pandemic, can't grow. It kills it. If R0 is very high, the black line in the figure is a value of 3.0. That means everybody's interacting with everybody. There's a lot of contagion. The disease is spreading. And you can see the black line shows the infection rate becomes very high. The death rate becomes high. In the bottom panel, at the end of the pandemic, a lot of people are dead. All right, and very few are susceptible at the end because almost everybody got the disease. If you lower, take the blue line, the blue dotted line, if we lower contagion, use social distancing, what's going to happen? Well, the good news is on the bottom. The good news is that fewer people die in the end. All right, still a lot of people die, but not as many. The bad news is at the end, there's still a lot of people susceptible. That's the middle panel. A lot of people susceptible means there could be a second wave. And the other bad news is the top panel. The infection lasts a lot longer. It slows everything down. Take the extreme case of getting R0 down to 1.5. That's the green line. We have very strict social distancing. What's that going to do? Well, in the bottom panel, you can see we are cutting the death rate in half. Much fewer infections. But in the middle panel, lots of people are still susceptible at the end. And this thing goes on for a long, long time. So if every day we're losing GDP because of these lockdowns, we're going to be losing a lot of GDP. So that's a problem. And here's one more problem. I hope I don't depress everybody with all of this, but here's another problem. The other problem is that there are increasing returns to scale to reducing contagion. Let me show you what's going on. The horizontal axis is the reproduction rate. This is the degree of contagion. 1 means that there's no pandemic, it disappears. 3 means everybody's interacting with everybody and no masks and, and look what happens. The black line is the total number of people that die. Now, this is for the United States with a population of 330 million and a death rate of 2%. So what it says is that for small values of contagion, reproduction rate, as you increase it, you get dramatic changes in the number of deaths. In other words, if you lower the reproduction rate from 1.5 down to, say, 1.2, you're going to get a very big reduction in deaths. Incremental deaths are much lower. But if you're already at 2.5 and you raise it to 3, it's not going to make a lot of difference. You'll get some increase in deaths, but not a big one. Well, now we got a complicated problem here. This says that, look, first of all, if we have very strict lockdowns, this pandemic is going to go on for a long, long time. And second of all, it doesn't really matter much if we have a mild lockdown or a strict lockdown. So we're not going to save a lot of lives. To really save lives, we have to go to a very, very strict policy of social distancing. It's the only way we're really going to get the death rate down. These are the problems we face right now. And this is what we have to deal with to do cost-benefit analysis with regard to COVID immediately. All right, so I want to come back to this question of the value of life because it's really fundamental to thinking about things like pandemics. So I said that in economics, we often use this concept of a value of a statistical life, a VSL. Here's the idea. Suppose your probability of dying this year is 2%, 0.020, all right? And we're going to offer you a job that's risky, but it'll pay you 50% more than you earn now. However, it raises your chance of death from 0.020 to 0.025. Should you take that job? Would you take that job? Well, the answer is it depends on how you value a 0.020 versus a 0.025 chance of death. So what we do is we look at the decisions that people make. We use data on millions of decisions of this kind. And not just jobs, but things like where would you live? Would you live close to polluted water? Would you live in an area that has more pollution, and so on? And we use this to estimate the VSL. And there's a huge literature on this, many, many, many studies. I mean, hundreds of economists make a living doing these studies. And the current estimates, they range from anywhere from $2 or $3 million to $15 million per person. And the regulatory agencies in the United States generally use a number like 10 million, all right? But there are problems with this. First of all, the VSL is based on a small increase in the chance of death, starting from a small number, not a big increase. Well, you know, we're talking now about significant probabilities. So is this correct, given that we're looking at bigger numbers? Second of all, the VSL is increasing in wealth. As you might expect, wealthier people are willing to pay more to reduce their chance of death. They have more to spend. Should we therefore value their lives more heavily? Well, that's problematic. And next, the VSL does not aggregate. Let me explain what I mean. If we think that the correct number for the United States is $10 million, and we look at the whole country, 330 million people, what do we get? We get $3,300 trillion. That's about 150 times the United States GDP. Well, we don't have that money. And we're not going to have that money for the next 30 years, or 50 years, or 100 years. So what does it mean to say that we're going to value those lives at $10 million? People may say that in their own mind, they're willing to give up $10 million for their own life. If we tell them, what are you going to pay to avoid death? Well, they may not have $10 million, but if they did have it, they'd probably give it all up. But there isn't that much wealth around. So how do you use this? And my view has been that this number is probably too high. And we should be using, for things like pandemics, probably a smaller number. How much smaller? That's tough. I'm not sure. But maybe in the United States, maybe it's $1 or $2 million. It raises a more general question. The VSL is about how people value their lives and the risk of death. But what we want to know is, how should society value lives, value increases or decreases in population? We don't know. So this is a question that, again, my co-author Ian Martin in London and I have worked on. We have a new paper that's coming out soon. And I'll just tell you a little bit about this. What we do is we look at two potential catastrophes: a pandemic, major pandemic, and an serious economic recession or depression. Okay? A financial collapse, whatever. And we calculate the willingness to pay to avert each one. We call the economic depression a consumption catastrophe because it will reduce consumption. We call the pandemic a death catastrophe. So WC is the willingness to pay to avert the consumption catastrophe, the economic catastrophe. WD is the willingness to pay to avert the pandemic. And there are two things here to note. One is these willingness to pay numbers are very high. Oh, WCD is the willingness to pay to avert both. And the WC, interestingly, is a lot higher than the WD. It turns out that because a consumption catastrophe is more frequent, we have consumption, you can call them catastrophes, disasters, recessions, because they happen frequently and they cause a lot of harm to people. The willingness to pay to get rid of them is actually quite high, right? It depends on the coefficient of risk aversion, but it's quite high. There's a curve labeled W prime C, and that's the willingness to pay to prevent consumption catastrophe if there were no death catastrophe, if there wasn't any possibility of a pandemic. The possibility of a pandemic raises the willingness to pay to prevent an economic catastrophe. Likewise, the possibility of an economic catastrophe raises the willingness to pay to prevent a death catastrophe, a pandemic, all right? If you look at the right side, we fix the coefficient of risk aversion at 3, and S, the horizontal axis, is a number that corresponds to the VSL, the value of a statistical life. If S equals 7, that gives you, in the United States, a $10 million VSL. But we said, look, suppose the correct VSL is much less than that. Suppose the correct VSL is not $10 million. Suppose it's only 2 or 3 million. Suppose that S is not 7, it's only 2 or 3. Well, what you can see in the bottom right-hand side is that even if we make S equal to 2, we're going to get a willingness to pay to prevent pandemics of close to 3% of GDP. Now, 3% of GDP, that's a lot of money. That's a great deal of money. How much have we actually spent in the United States per year to prevent pandemics? To a close approximation, 0, almost nothing. How much are we spending this year in terms of government efforts not to provide economic assistance, but government efforts to manufacture masks, to invest in vaccines, to invest in drugs, to finance a growth of the CDC and so on? Almost nothing. In fact, the Trump administration wants to cut the budget of the CDC, and we've left the World Health Organization, and the United States is not paying its dues to the World Health Organization. So the willingness to pay for any value of the VSL is much higher, much, much higher than what we actually spend. This is the problem. This is the difficulty we have. How do you value changes in population? We don't know. You know, some people say that increases in population are a good thing. We need them for growth, technological change. We need young people to support the old people. Some people say growth in population is bad. Crowding, congestion, the environment. Good or bad on net? Nobody agrees. We don't know. We seem to think that decreases in population are bad based on social policy because we try to save lives and we try to prevent the loss of life, anything from traffic accidents to disasters. But how do you value these increases or decreases in population? This is an open problem. This is, I think, one of the most interesting questions in economics today. How do you value life? How does a society value changes in population? All right, what are we going to do after COVID? Here's some more bad news. First of all, let's say we have a vaccine. Suppose we get the vaccine. It's a year and a half from now, we got a vaccine. How long will the immunity last? We don't know. We know that the flu vaccine, the immunity lasts about 5 months. How long will the immunity last here? We don't know. How effective? 50%, 30%, 80%? We don't know. What if we have multiple strains of COVID? Will a vaccine cover every strain? We don't know. And we know that every virus mutates. Here's something interesting. They discovered frozen bodies of Vikings. About 1,200 years ago, these people died, and they were able to get the DNA, and they found out that these people had smallpox, and they were able to isolate the smallpox genome. It's amazing what's come out of this. And what they found is the genome is very large. It evolved over the last 1,000 years to a smaller genome. Larger genome has a lower death rate. It's less harmful. Smaller genome, 30% death rate. Well, that's smallpox. What about COVID? How is it going to evolve? How is it going to mutate? We don't know. What do? We're right back to the pre-COVID problem. We have to spend more, much more, preparing for the next pandemic. And we have to, because the next pandemic might be a variety of COVID, a mutation of COVID. And we have to face the fact that in addition to pandemics, we face other things, really bad things that we don't like to think about. And we have to spend money to prevent them. Nuclear terrorism, we spend almost nothing. Bioterrorism, we spend almost nothing in the United States. Climate change, we do very little right now. And on and on. So let me summarize. First, before COVID, should we have been surprised? No. The CDC, the World Health Organization, many people told us a major pandemic was just around the corner, a matter of time. And other catastrophic threats, nuclear terrorism and so on, have always been clear, but governments are unwilling to do much. That's sad, but that's how it is. During COVID, lockdown, school closures, but how strict? It's a cost-benefit problem. The benefit is lives saved. We have to think hard about how to value those lives. It's a very big problem. And we have to recognize that while strict social distancing reduces the infection rate, it lengthens the horizon. After COVID, well, hopefully we'll have a vaccine, and hopefully it'll be a good vaccine. How effective? How long will it last? What if there are multiple strains? We don't know, but we can hope. The virus mutates. We don't know how COVID might evolve. That's why, in some sense, even after COVID, we're at the beginning of COVID because we have to plan for mutations that would result in a new pandemic. What do? We're back to the pre-COVID problem. We have to spend much more preparing for the next pandemic, and we have to face the fact, we don't like to, but we have to, that we face multiple potential catastrophes, and we have to spend more to prevent them or reduce the likelihood of them occurring. I will stop here, and we'll see if there are questions or discussion.
Bob, thank you very much. It was very good, informative and interesting talk. I liked it. And I've been attending your seminars before too. And my comment on your research as a whole is, I think, this in the center. My first comment by looking at the COVID-19 is that, wow, Bob was right. I never thought that it would come right in front of my eyes so quickly. Although, you know, I have been writing papers on disaster in a different viewpoint, from a different viewpoint. I never thought it would come so right in front of my eyes. But more important thing, what was surprising to me was I didn't know it came in the state where the world is in such a fragile circumstances, in the politically, the UK, US, all over the world. The political system is in a very, very low, unhealthy state, I feel, right now we are in. And that was, if I think about it, it's a huge surprise to me. It's unfortunate, I felt. So that's the first comment. I like your research on from the viewpoint of economic analysis and cost-benefit analysis, and your approach is right vis-a-vis measuring the value of life and measuring the potential cost of doing whatsoever we do have to deal with this kind of disaster. I think it's a right approach. And me myself is an economist, so I like your approach of ex-ante approach to calculate the cost and benefit and see what kind of preparation we could make. And you may be right, you may not be right. The opinion could differ about the value of life, potential value of life. You say 10 million is too large, and I am not sure about that. But that's just a matter of discussion, and we can fine tune about the value of it. And by doing that, we could do really serious good preparation against this kind of thing. Unfortunately, we didn't do really well. I think American government has been trying very hard to cope with this type of problem. But first thing I felt is it came in front of my eyes, and the world is politically so screwed up. And what do we do about that? And that's the major, I think, point. This time I looked at your study. Last time I agreed almost completely about what you told us, because I was just looking at an economist from the viewpoint of economist. But by being in this current situation, I think political factors seem to be very, very important. And that's kind of thing I would like to address, and I would like to see your opinion about. And I've been writing about analyzing a disaster, and many serious accidents and so on have both natural and human causes. And in many cases, human causes are related to politics and political leaders. They make mistakes, and they misjudge the situation and misinform the people. And that makes really the situation worse. And I just really would like to see how the society could deal with in ex post rather than ex ante. Although I'm an economist, I should be ex ante theorist, but in this particular thing, as you said, this kind of disaster is really once in 100 years or once in 20 years occasion. So we would like to know more about how to deal with the situation when it actually occurs. And I just read in the Washington Post a couple of days ago, now it seems to me the scientists seem to agree that the mask is the simplest and the most effective remedy or the way to fight against the pandemic, and which is really true based on our experience within Japan, because we are very, very fond of masks. And as soon as COVID-19 hit us, we started using it. Not even the government told us, but voluntarily. And many people had masks within your home because we have lots of bad allergy problems. And the masks are very effective to go against it. So people used to that, and people use the mask very much more. The masks are much more readily available within the household. At the same time, they're willing to use it. So given I agree with this particular thing that mask is the most important thing. But on the other hand, even Dr. Fauci in February said there's no reason for anyone in the United States to wear a mask. And the Surgeon General said that seriously people don't buy a mask. And they were very afraid of the possibility that they will lose the mask for the medical professions. And because of that, they tried to suppress people's use of it. And on the other hand, this was a huge mistake in the retrospect. And I don't know how to avoid this, but if you were this guy, you probably know of, he got killed. He was I forgot where it was, but he was a god for the a big
I didn't see this.
pharmacy. Yeah, he was a god in I think it's Target or something. And he asked a customer to wear a mask. And the lady and the family came back with a gun, and this guy got shot to death. And whether or not people use masks are kind of matter of judgment. So the previous page I talk about here is a kind of a scientific judgment. But somehow that got dragged into the situation where somebody got, killed. Just a few days ago, I read somebody got beaten up for the same reason at the store. And that's coming from kind of politics. And the President Trump has been very, very reluctant and anti-masks and created a kind of very strong anti-mask sentiment. And all those political failure seems to be kind of very important factor in determining the cause of pandemic or any other accident. I wrote about the nuclear accident sometime about the Japanese nuclear accident. And it's a similar kind of thing occurred. And my question to you is, so like as you emphasize preparation against possible disasters, that's a very, very important thing. And thanks to you, that I was able to prepare against something like that. But I would like to know more about the political factors. And two, I wrote another paper just recently, which shows that people's self-protection effort seems to be really a key to go against this kind of pandemic. Not economic, not anything like that, but just looking at the people and keep wearing masks or being kind of cautious approach to the world. That seems to have helped a lot. And so I would like to know your thought on these factors and any other factors you might think crucial in the situation where we are actually dealing with the ongoing disaster. That's my first question.
So let me address that.
Yeah.
Look, it's very, very sad what we see in the United States. There is no real leadership. There is no rational, coherent policy. And what's happened is that, in February, the business with the masks is that we didn't have masks and we didn't have the health workers. But that's an example of a problem with the healthcare system in the United States. Why didn't we have masks? Why couldn't we produce them quickly?
That's right.
So the difficulty here is that right now the United States is an extremely polarized country. Mm. And what happened in that example where the person at the store was shot and killed, it's this anger and it's this polarization where people instead of looking at this as, look, are masks a good thing, not a good thing? What is first, the government doesn't give a clear picture. It doesn't say clearly what to do. Now, you know, yes, you should. Fauci says yes, they're good, but then Trump says no. So there's no clear picture. Some governors in some states promote masks, some don't. And the result is that people kind of view it as almost a political statement. If you wear a mask, it's almost political. And that's very sad. And, you know, what do you do with an ongoing disaster? You don't do what the United States is doing. What the United States is doing is we are completely, there's virtually no coherent leadership or policy at the federal level, and it's being left to states. Now here in Massachusetts, I'm in Boston, we actually have a governor who's very, very good. And here, I think the policy has been excellent. The number of infections is close to zero. It's very low now here in this state. But that's this state. And you have other states like Florida, Texas, Arizona, where there has been very little in the way of a coherent policy. Things have opened up too quickly, and now the infection rates are exploding. So you need to have leadership. I mean, sadly, countries are not good at this. Why can't we prevent these things? Why can't we spend the money to prevent these kinds of catastrophes? Because we're not good at this. We don't have the political will. Why can't we do a better job now that we're in the pandemic of controlling it? Because once again, we don't have the political will. We don't have the leadership. And that's just a sad thing. So, I read your papers. You sent them to me. They're very good. That's kind of sad. This is the situation we're in.
Thank you. It's really depressing to see that way. I would like to see how you can cope with it, and how, you know, one can, is there any bright side from this experience? That's my another question, if you would point out.
You know, you began by saying that you were surprised that COVID happened. This happened so soon. And now, why were you surprised? So the reason, I think, is that we, people, human beings, we like to think that nothing is going to change, anything important. We like to think that our lives are going to go on in the same way, and that the world is going to look the same, and society is going to look the same. And yeah, we know that we might get sick, there are problems, you know, things can happen, accidents. But basically, we like to think that it's very hard for people to think about major upheavals and changes that would just completely change their life. Very, very hard for people. And so I think that's why we were so surprised by this. How could this happen? Well, because these things happen. And more things will happen. They will happen. We don't know when, but that's how it is. And it's very hard to come to grips with that. That's a human characteristic. And because of that, it's hard for governments to say, look, we have to spend lots of money now in order to prevent things that might happen in 20 or 30 years. When people say 20 or 30 years, I'm not going to be around. Well, if you care about your kids and grandchildren, you better spend the money now. It's very hard for people, very hard for governments to do that.
I agree. I think that goes back to my first comment on your work as a whole. I think it's very important that a person like you conduct this type of research. That does prepare people may not be so clearly like your model is describing, but at least like by attending your talk 3 years ago, I suppose, at RIETI, you talked about this kind of aspect, and I kind of kept in the back of my mind that this could happen, and if this happens, something has to be done, and some kind of care have to be taken very carefully, and that kind of helped me a lot at this particular moment, but for being the chair of this large institute. It's, that kind of research is very, very important, I think. So I appreciate that aspect of your research, teaching general importance of the preparation, rather than we talk about life is worth $10 million or $2 million. That's a research subject, and that's have to come with it. But in general, I think that's a very, very important thing. I do appreciate and your foresight and your insight about it. But another next question I have is this, that it's a very related thing, but a lot of observers say that even if vaccines are developed, it'll be very hard for the government or people to convince a particular type of people who don't want to even take a vaccine. And that will kind of prolong the this American economic downturn for could be like 5 years, 10 years. How would you cope with this problem?
So I don't think that's so much a problem. If you look at measles, we have a vaccine for measles, and there's some people who don't like vaccines, they're against it. But you know, you can do things like the kids can't go to school if they're not vaccinated. So you can do things to push people to get the vaccines.
I see.
I think we've been fairly successful. I have a different concern, and that is that there are a lot of poor people who don't have health insurance in the United States. How do you get them vaccinated? Where do they go to get vaccinated? How do you, they don't have any health care. They don't have a doctor to go to. So I'm more concerned about even getting people, assuming everybody wants it, getting it to people.
That's true. That's very true. I always support that Americans have to provide the service for free, I think.
Well, you know, the health system and the healthcare in the United States is very complicated, and it's not a great system. And you know, for some people, they can go and they can get it for free. Some people can't. Some people don't have any healthcare, and some people don't have the money to go and spend. You know, even if it's only $20 or $100 or whatever. So I'm worried about that.
Well, I have a third question is, I think you kind of answered during your talk. So I think I'll skip this third question. And I just go to my last question, which is kind of difficult question to answer, I know, but as I said that from the beginning, that I feel unless a nation has a right leader, it is hard to deal with a potentially really disastrous event in the case it happens. And my question is that what could you do if a wrong leader is in power when the disaster happens? That's a kind of thing which is very difficult to address. And of course, if you are kind of militaristic regime, you could have a coup d'etat and so on, but that's unacceptable for the democratic society. Then is there any sensible approach to this kind of problem? Americans tried by impeaching the president, but it didn't work out very, very well. And how could you cope with this problem when something like this happens?
You know, I guess I'm a pessimist here, and I think it's very hard to. I think that, you know, here in the United States, we're going to have an election in 3 months. You probably know what I'm hoping for, and that is that we elect somebody else, that Trump no longer is president. We don't have the right leadership now, in my opinion. But, you know, what do you do? And, you know, if you look at histories of countries and histories of civilizations, why did the Roman Republic fall? You know, why did the Roman Republic disintegrate? What was wrong? And, you know, you look at history, and there are wrong leaders. And when wrong leaders are there, bad things happen. And, you know, we live in an era right now where there are lots of things. I have talked about catastrophes that are outside the political spectrum, that are, well, nuclear terrorism, bioterrorism, climate change. What about war, nuclear war?
Right.
And, you know, you look at how many countries, you look at countries that have nuclear weapons, look at, and you ask, who's in control of those weapons? And can we rely on rational decision-making? And we don't like to think about those things, but I worry that there are a lot of dangers, a lot of risks. There's a lot of risky things out there. I mean, it's almost like I should go back and get into bed and not come out because there's so much danger. But but I think this is the way it is. And I think that if there are wrong leaders when there's a disaster in a democratic society, we have to hopefully limit the damage that a wrong leader can do. Now, right now with COVID, Trump is limited in terms of how much damage he can do.
Right, right.
So, you know, we're dealing with it in the United States. We probably could have dealt with it better, but we're dealing with it. And we could have saved lives, but I think we're going to come out of it in the end, okay. And even with not the best leadership. So we try to make do. We have to do the best we can with the leadership we have, with the government we have. It's difficult. You know, I hope this talk, I've enjoyed this. I always, and I'm hoping that I can actually come to Tokyo at some point. Now there's no travel anywhere. Can't go anywhere, I'm stuck here. But I hope I can come back to Tokyo and visit in person again. But I hope this talk has not been too depressing for people who watch it. You know, I wish I could say something that's more cheery, but what can I do?
Actually, by listening to your talk and presentations and this conversation, I felt that you're rather optimistic. If you're a real pessimist, you can't really think these scenarios so deep like as you can do. I thought I myself is an optimist, but I can't dare pushing myself in this direction. So I think you're a quintessential optimist. Please send my regards to your wife on this issue. That's my final comment.
I'm going to tell my wife.
Thank you very much.
Thank you, and thanks to everybody who watches this. I enjoyed this, and I hope it was interesting for people. Thank you.